The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
Welcome to the November 2020 edition of the Dr. Fazil Show. We have award-winning Dr. Fazil here with us today, and today's topic will be back pain.
Thank you, audience, for watching this show today. Thank you, Jose. As we are going to discuss the different causes of back pain. Back pain is one of the biggest healthcare condition nationwide. It's one of the biggest expenses and one of the biggest cause for being off from the work. If you look at all the different medical conditions we have, the back pain is almost the number one. Time off from the work, medical expenses, disability, and a whole different snowball effect from the back pain. So today we're going to talk about what is the back pain, where does it come from, is just one condition which causes back pain, or there are multiple conditions. So the back pain, especially the lower back pain, can come from different sources. The most common cause is muscle spasm. It depends on also the age group. In younger patients, it's generally the muscle spasm. In older patients, the cause of the back pain is generally a pinched nerve. The pinched nerves generally have different features. The pain will radiate to the leg, right or left leg, or both maybe. Sometimes it stays just in the middle mid back. And if we look at the MRI of a patient who have back pain, we will see that they have various sources of pain generators. For example, arthritis of the spine, pinched nerve, bone spur formation, or also sometimes the pinching of the whole spinal cord by itself. That can cause back pain as well. So sometimes you can have more than one cause causing back pain. So when we do see the patient, we have to take the history, examine the patient, and then sometimes we have to do appropriate tests, including X-rays or MRIs, and that will explain where the pain is coming from. Once we know the source, then we can work on it.
And Dr. Fazil, is back pain only from the spine, or do other organs cause the pain as well?
Yes, so the back pain is not only from spine, other causes can play as well. For example, kidney pain can cause back pain as well. So if you are having a severe back pain, don't automatically think it is just spine causing back pain. It could be infected kidney, a blocked kidney, or it could be due to trauma to the soft tissue causing pain, or even sometimes I have seen herpes or shingles in the very early phase before it becomes visible can cause back pain as well. So good history and good physical examination is the key to making a right diagnosis, in addition to appropriate diagnostic testing. So as I said, back pain could be from spine, from the kidney, and also from shingles in the early phase. Before it gives a rash, it can cause pain. So we have to be vigilant that does not take it granted that every back pain is from the spine. So if the pain persists for more than a few days, please do contact your primary care doctor for appropriate diagnosis and treatment.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
And Dr. Fazil, how can somebody differentiate from kidney pain versus back pain?
So the kidney pain is generally, if it is due to the infection, it will be localized to the mid upper back, not the lower back. It is dull, and the patient would also will have fever, or nausea, vomiting might be there as well. If it is due to a stone, it would be like a colicky pain. It like comes and goes, very severe pain, and it radiates to the groin in the front. That would be a kidney pain. Back pain is generally speaking, in the lower back, and it radiates to your legs, and it is generally like a dull pain. It gets worse with walking and bending over or straining, versus it gets better with rest. That's how you can tell clinically if it's back pain or kidney pain, but sometimes it could be mixed, and a qualified healthcare provider can tell you what the source of pain is.
And Dr. Fazil, how generally would you treat back pain?
So again, as I said, the treatment depends on the source. So first we have to identify what the cause of the back pain is. If it is due to, for example, kidney infection, then we'll obviously treat the infection with antibiotics. If it is a stone, if it is too big stone, it might need to be seen by or removed by surgical means, a urologist. If it is due to spine, then if the clinical indicator shows it is due to muscle relaxer, then like if clinical examination and history does indicate it, if it is due to muscle spasm, then I will recommend obviously using some conservative treatment, for example Tylenol, ibuprofen. If you do not have any kidney problem or dysfunction, then Tylenol or ibuprofen would be okay for a few days. Maybe some local heat treatment. But if the pain radiates to your leg, then it's probably pinched nerve. Then we use a medication known as gabapentin or Neurontin or Lyrica, or a medication in such category which will numb the nerve pain. It's not a narcotic, but it does help with the neurogenic pain. That might be the first few steps. Other steps, if the pain persists for more than a few weeks, would be rehab, physical therapy, or traction, where the traction spine by the experienced person or healthcare provider, or spine manipulation. That would be the first few steps in managing the back pain. If the pain persists for more than a few months, and then there might be a need for MRI. And if it shows, if there's for example, a pinched nerve, and due to disc herniation, then spinal injection, for example, epidural injection, which is given in the tail of the spine under the fluoroscope machine, might be in order. Sometime oral prednisone might help. Sometime muscle relaxer might be used in this condition. And then the next step would be obviously surgery if the pain becomes persistent and does not go away with all other conservative means. In between the surgery, obviously chronic pain management done by chronic pain management specialists. For example, opioid might be an option, but that is probably the least option because of the side effect involved with the use of opioids. So, and there's a new treatment now which is known as spinal cord stimulator, where they actually put a device in the back which have electrodes, and it goes around the spine. It can actually, it is controlled by the patient. What happens is when the patient feels pain, they press the button and the machine generates the shock to the spine, and the brain perceives that shock instead of pain, stimuli, and the pain goes away. So the brain does not perceive the pain receptors, but it perceives that shock sensation instead, and it fools the brain that the patient doesn't feel pain anymore. So that would be one of the options for advanced pain management. So there are different options. It all depends on how bad the pain is, what has been tried in the past, what worked, what didn't work, and how long the pain has been there.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
And Dr. Fazil, is there any role of stem cell in pain management?
So it's a very good question. Jose asked if there's any role of stem cell injections in pain management in the back pain. The answer at this time is no. It is not FDA approved at this time. I know there's a few centers in different part of the world that are advertising as injecting stem cells inside the spine. The way it's supposed to work is that stem cell will, we remove the stem cell from the bone marrow, and they are injected inside the spine with a needle, and they're supposed to go and produce new cells. So anywhere where there's the injury, the stem cell will go and produce same kind of new cells there. So the injured disc, for example, will become a new disc, and hence the pain will go away because that was the source. In theory, it seems that it should work. In reality, it has not shown any significant improvement. So therefore, FDA has not approved this treatment at this time. It is still considered as an experimental treatment. So my answer is no.
I'd like to thank our audience for viewing the November 2020 edition of the Dr. Fazil Show. Stay tuned for our December 2020 edition of the Dr. Fazil Show.
Thank you, our audience, for watching Dr. Fazil TV show. Stay safe. We will be back next month with more update on different health conditions. And thank you for watching this show. And have a nice day.